The gallbladder operations are, I would say, the most common major operation that any surgeon would do. Typically, this is done in a keyhole approach or a laparoscopic approach. Essentially, there will be a camera going through the belly button through a 1 or 1.5 centimeter incision, and then there will be 3 more incisions over the upper tummy. They will be in the upper tummy, and on the right side, they will be about a centimeter in size. So essentially about 4 little holes, and through that, keyhole instruments will be put into the belly, and we will be taking the gallbladder out that way. The operation always involved a dye test to the bile ducts called intraoperative cholangiogram. That's part of the test, part of the operation. And this procedure is done as a day case operation where you come in the morning and get it done and go home later on. The operation is done under general anesthesia. As it is done under general anesthesia, you need to be accompanied by someone to go home with, and who could stay over for the next 24 hours. And there will be no follow-up most of the time because it is really not necessary. Now, there are no major restrictions after a gallbladder operation. As I said, it is done under as a day case operation. You'll be going home on the same day. The sutures are all absorbable. No suture need to come out. Wounds will be all glued. So that means you can have a shower from next day onwards. Of course, we ask not to lift any heavy weights. Anything where you have to contract the muscles, not to do, to avoid having incisional hernias later on, because the healing process takes few weeks. So for 4 weeks, one should not lift any heavy weights. We also advise to stay at home for about 2 weeks. When I say stay at home, it is stay off work. You can go out and about and, do light exercises. That's perfectly fine. And of course, we wouldn't want someone to drive within the first week because the seat belt goes across the wounds and it will be not safe if you were to drive. Diet-wise, there are no restrictions. Of course, one will find it a bit difficult to manage a heavy fat diet. So it's best if you avoid one for the first week. But of course, after that, there are no restrictions at all. Now, fortunately, gallbladder operations are quite safe. Very, very unlikely that someone will end up having complications after this operation. The commonest complications, again, although they are very rare, less than 1%, would be infection and bleeding. This is just, if you have a cut anywhere in your body that can get infected, that can bleed a little bit, and there are ways to control those. And again, as I said, they are very rare. But the more important complications are about 0.5% of patients, that is 1 in 200 patients, will end up having injury to the bile duct or to the bowel. The reason is the bile duct and the bowels are just next to the gallbladder, separated by about just a couple of millimeters, really. So because of the sheer proximity, they are at risk of damage. And of course, if they do occur, they are quite significant complications, and you might even end up having to have a big cut to fix that out. But most of the time, we can deal with it keyhole. And again, as I said, there are very unlikely events to happen. And of course, the other complications are more generic complications like clots in your legs and going to the lungs called DVT and pulmonary embolism. And of course, the anesthetic risk, which will be discussed by the anesthetist on the day. Well, the simple answer is no. Traditionally or historically, there had been attempts to manage gallstones without having to have an operation by way of gallstone dissolving medications, and also with what is called lithotripsy or stone shattering mechanisms. But in particular, when it comes to gallstone dissolving medications, they are only effective in cholesterol stones. They are not effective in pigment stones. And even then, one need to take medications for a longer period, sometimes over a year. And quite often, when you stop taking the medicines, gallstones will reform. As such, in present day's practice, most of the surgeons will not recommend these medications. When it comes to lithotripsy, again, it is the same. It is not used often, and it is not recommended by the present day surgeon. So the simple answer is if you have symptoms from gallstones, or if you have had a complication from gallstones already, the option is always a surgical option.